I'm the Director General from the King Hussein Cancer Foundation. But the most important title for me actually is that I'm a mother of a cancer survivor.
Sure. Tell me about the cancer survivor, first of all.
Yes, my son had leukemia at the tender age of 2, actually 2 days short of his second birthday. And actually at the time we were in England. My husband was about to start his master's degree in Cambridge University. His sister had chickenpox, then he had chickenpox, and then lo and behold, we had our cancer. And it's a very interesting story. I'm not sure if you want it on this program. At the time, of course, because we were students, so we would go to the National Health Service in England for the, not knowing, of course, that my child had leukemia, not an inkling. You know, you don't go there. As you know, the symptoms are very similar to a flu. And we went there, and each time I would see a new doctor at the emergency room. And of course, he would ask me, I'm the mom, and we would have either Panadol or some antibiotic and so on. But I knew as a mom there is something. I didn't know what it was. I didn't even go towards the word of cancer, but I knew something was wrong. So one day I called my doctor back home, and I still have that paper. I actually wrote down the symptoms of leukemia without ever knowing or reading about leukemia. And he told me, Dina, just get a blood test. So I was very happy, great, blood test. And you know, in the National Health Service, you have to be referred to get a blood test. Somebody has to say, not like in Jordan, you can just go and pay in a lab and get one. So I marched into the National Health Service thing without an appointment. And I said, I just need a blood test and I'm very happy to pay. And the lady said, I'm very sorry, you don't have an appointment. Without me knowing, I started crying. And then one lovely lad, his name is Stephen Foley, we never forget him. And he stood up and he saw this tall woman with a child in tow, crying, you know, with her heart out, not knowing, of course, at all that we had cancer. And he said, I believe she can take my appointment. And he was only 18. Of course, I don't blame the lady. I did not come with an appointment. But anyway, he gave me the appointment. And then the moment then the doctor saw, of course, his platelets were down. She said, I think you can go to the hospital now. And that's how our journey started. And because of your wonderful relationship with His Majesty King Hussein, when he heard about the story of Stephen Foley, he actually invited him and the whole family to Jordan. And it's just such a nice, I'm forever grateful for him. And that's how we started our journey.
And now you're really getting stuck in about the advocacy. And now you're giving something back, I suppose.
Yes.
Tell us about the foundation.
Yes, after England, my son during treatment, I knew that he might need some bone marrow transplant. And so we went to the States, because actually an English doctor told me at that time that it's good to go to a place where there is volume. And so we went to Boston, to Dana-Farber Cancer Hospital. And sure enough, he relapsed and we had to have the bone marrow transplant. And so when I came back, we finished the treatment there. Of course, it was like a grueling 2.5 years treatment. We went back home, and that's when Her Royal Highness Princess Ghida Talal, our chairperson, who is a wife to a cancer survivor, His Royal Highness Prince Talal, she asked me to join the fight. And of course, I knew, that this is something now. My son, alhamdulillah, as we say in Arabic, that he survived cancer. I was of the lucky few that could go abroad to get treatment. You know, thousands of mothers, just like myself, don't have a chance. They would have mediocre treatment at home, if any. So I have to give back. This great luck, using my title, it's not there for free. You have to give back and utilize it for something.
The work of the foundation has spread way beyond Jordan. You're international, you're famous, you're making an impact. How do you handle that? How do you use that for the benefit of cancer patients in Jordan?
You know, what's wonderful about really this foundation and the Cancer Center is that we really grew organically. And scientifically, and we mobilized the whole community. That really has been our story. And from that, and we were focused. In the beginning, we focused on treatment because I know many people, when we would go to these wonderful conferences when we first started, they say, oh, you have to work on prevention, you have to work on early detection. And we said, no one is ever going to listen to us when they still believe you die from cancer, because all they see is people walking vertically to the cancer center, coming out horizontally. So the only key to unravel everything was to deal with treatment. So all our focus went on treatment, and then we went on early detection, prevention. Now we boast one of the top national breast cancer programs in Jordan and so on, and fighting tobacco and moving on to other spheres in the comprehensive cancer care continuum. Of course, we are not just a local center. As you know, many in the region, before or even after their health systems have been decimated, we are really our first port of call for them. We have patients from Palestine, Iraq, of course Syria now in droves, of course, Yemen, Sudan, Libya. We even have people coming from Algeria, believe it or not. So we are not just a local center, we're really for the whole region. And we take that role very seriously in terms of working on awareness, on advocacy. We have our cancer center helps train many cancer centers, being in Palestine, in Morocco. We have agreements with them. We're very open to sharing our knowledge with everybody, because the region is still far behind into delivering quality cancer care. And globally, of course, we really always want to share our story, because, and I see it, whenever we come to this conference and they hear about this little cancer center in little Jordan, but little Jordan in size, but big in spirit and ambition, and they feel they can compare to us much more. They feel if Jordan can do it with small resources, then we can do it. And we have many calls from South America, from Africa. Recently now, I've just met 2 ladies from Kazakhstan. They want to come and meet with us and see how we're doing things, because they feel if we can do it, they can do it. So we take that role very seriously, and we love to share our work. And all for free, we don't charge anything to our developing fellow countrymen.